When it comes to improving your heart health, one of the key components is to know your numbers. But what numbers count when it comes to your heart? Here today to explain which numbers matter and what those numbers should be is Dr. Manfred Sandler. Good morning and welcome back.
Hi, Christine, and thanks for having me back.
I am not kidding. I'm starving. I need a plate of pancakes.
We're happy to serve you directly after this.
Okay, good. Well, of course, before we get to my numbers, because you did the screening on me this morning, talk about what numbers we all need to know.
Well, basically, we're going to learn today what, in my opinion, an ounce of prevention is worth a pound of cure.
Yes.
And we really need to take ownership of our own health these days more than ever before. So the numbers that we did in your screening basically are to do with your cholesterol profile, your amount of fat in your body called your triglyceride profile. We did your blood pressure. We measured your body mass index. These are all numbers that are eminently measurable, and I'll show you at the end of the show how we use them to predict what risk you are from a cardiac risk.
Okay, and the nice thing is you took these tests, a simple blood test, and I received my numbers within 5 minutes. So don't ignore it. It's an easy thing to do, as you said. Be preventative and be proactive and get these numbers now so you know what you need to work on. And let's dive right in. Let's see what my numbers were, and I want to make sure if they're good that I take them home with me because my mother's always worried about me. It's typical.
Well, I'll be happy to give you a copy of this at the end, and I'm very pleased to announce that I think you're a very healthy young lady.
Excellent. Excellent. Right. Yes, good to know.
That being said, let me tell you what we did on you this morning.
Okay.
We, first of all, we did a little finger stick and we measured your cholesterol profile. And within that profile, we measure three different things. We measure your total cholesterol, which ideally should be less than 200 compared to the American Heart Association. Yours was 157,
Great.
which is excellent.
Good.
We then measured what's called your HDL cholesterol, which is your heart protective cholesterol. Basically, the higher the better. The goal of this cholesterol, for females, we want greater than 50. For males, we want greater than 40. If it's greater than 60, it's actually heart protective. And I'm happy to tell you yours is 65.
Hey, all right, good. This is making me feel good.
Following this, we measured how much, what a good meal, let's say, you had last night, and how much fat you're eating, and how much storage you've got of fat.
I was telling the doctor I went to, what was it, Stony River in Duluth. Delicious. I met my girlfriend there. As I'm about to have my wine, I was having red wine, red meat, mashed potatoes, bread. I thought, ooh, all this before a test. So how did that pan out?
Well, your triglycerides, which need to be less than 150, were a whopping 48. So really, almost no fat storage in your body.
All right, good, okay.
And lastly, we have what everybody remembers when they go to their doctor, which is the bad cholesterol, which is your LDL cholesterol. Now that, the level according to the American Heart Association depends on the amount of risk factors, but basically somebody with no risk factors, we need it less than 130. Somebody with 2 or more risk factors, less than 100. And if you've got known cardiac disease with high risk, we need it less than 70. Yours is 82.
82, excellent. So that's great.
It's excellent.
And then I know you had me squeezing that machine standing up, and that was for my BMI, my body mass index, right?
Excellent. That's absolutely correct. And the other way we can get an idea of your risk these days, if you give us your height and weight, which you did, we can measure your body mass index, which is pretty much a percentage of fat in your body. The ideal body mass index is between 14.9 and 24.9. If you're from 25 to 29.9, you're overweight.
Okay.
If you're from 30 to 40, you're obese. And if you're greater than 40, you're morbidly obese.
Oh, wow. Okay.
Well, your body mass index was 18.6.
Excellent.
In the perfect
all
level.
Right. I want to go have a big breakfast after all this good news. No, it's so good to know.
It's excellent. I just wanted to mention one other thing. If you don't want to do the height and weight, then if you measure your waist at the level of your hips,
right.
Females' waist should be less than 35 centimeters and males should be less than 40 centimeters.
Okay, so these are the important numbers that when somebody were to come to see you and say, doctor, I need a screening, I want to see how my heart health is, this is what you give them, and this is kind of the starting point for you as to where they go from there, right?
Absolutely, and the only one last thing that we did measure which helps us define risk, is your blood pressure. Okay. Because blood pressure is another huge risk factor with regards to vascular disease. Ideal blood pressure less than 120 on 80. If you're between 121 and 139 over 81 to about 90, you're pre-hypertensive. If you're greater than that, you have high blood pressure and you need to be treated. If you're in the pre-range, you need to do exercise, diet, weight loss, don't add salt to your food, no medications. But yours is 115 over 69, which is absolutely perfect.
Okay, excellent. Good to know. And I know that these are just the starting point for numbers, but what other numbers should we take note of?
Well, basically, when you're talking about other numbers, it's not really a number, but one is people always ask, can they have a glass of wine, just like you had last night?
Right.
And basically, the recommended the number of glasses of wine or alcohol per se for a female is 1 drink a day, and for a male is 2 drinks a day. Now,
Okay.
obviously, you can pour the whole bottle into 1 drink, but
Yeah.
we want you to be conservative about it. And lastly, which is not a number, basically, don't smoke.
Okay.
We know that. According to exercise, we want you to be doing 20 to 30 minutes of exercise at least 5 times a week, and that's continual exercise. It's not 5 minutes on, 5 minutes here and there.
Okay. So that's pretty good. I mean, that's reasonable. It really is. And I know that for those people who are still trying to figure out or want to figure out their numbers, you have a calculation, right?
Absolutely. So this is putting it all together. I've given you a lot of numbers then, but people say, well, what do we do with these numbers? Basically, there's something called the Framingham risk score, which is a 10-year risk of cardiovascular disease in adults above the age of 21 who haven't got really the disease already or significant risk factors. So I think you can see it on the screen, but we plugged in your numbers, the Framingham risk score, and basically looking at your blood pressure, your age, female, total cholesterol, HDL, whether you smoked or not, your risk is 0% over the next 10 years.
Fabulous. Seriously, zero.
Absolutely zero.
I love that.
You can go to our website, which is gmcheart.com/your heart, and you can put your own, anybody can plug their numbers in and calculate their risk. Basically, if you're above 10%, between 10 and 20%, that's an intermediate range. You really need to get with your doctor and possibly have some tests and possibly be on medication.
Sure.
If you're above 20%, you've already got the disease. You really need to see your doctor.
Okay, fabulous. This was so informative. Thank you so much for doing this. I appreciate it.
Well, my pleasure.
It was worth me being sluggish and starving this morning. It really was. And thank you. And congratulations on the new Strickland Heart Center.
Well, thank you very much. It's opened, and we are now 3 weeks into it, and we've really done about 2.5. We've done over 2 dozen surgeries. Fortunately, everybody has been successfully treated.
Wonderful.
And we're up to our 1,000th stent this week. So
Fantastic, doctor. Continue the good work, and thank you for always being a great guest here. We appreciate it.
anytime. Thank you very much.
Thank you. And if you would like to know more about what your numbers mean, please visit 11alive.com/takethepledge. You can take the pledge yourself and receive a free pedometer, as well as learn more about heart health from Atlanta's heart experts, who of course work at Gwinnett Medical Center, Strickland Heart Center. And for more information on the Strickland Heart Center, visit gmcheart.org. And this segment was paid for by Gwinnett Medical Center.